Is directly observed treatment, short-course DOTS, effective against dry TB? Imagine a treatment approach that has saved millions from tuberculosis. That's what DOTS has done for drug-susceptible tuberculosis by ensuring patients take their medications properly. It involves health workers watching patients swallow their pills daily, which helps prevent the bacteria from becoming resistant and ensures the disease is fully cured. But when it comes to drug-resistant tuberculosis, the story gets more complicated. Drug-resistant tuberculosis, including multi-drug-resistant and extensively drug-resistant strains, has bacteria that no longer respond to the standard first-line drugs used in DOTS, like isoniazid and rifampicin. Since these drugs are the backbone of the original DOTS regimen, using it alone against resistant strains isn't effective. If you try to treat resistant TB with the same drugs, the bacteria often survive, leading to treatment failure and ongoing transmission. The original DOTS approach was designed for drug-susceptible tuberculosis, where the bacteria are still sensitive to first-line medications. It works well in that context because it promotes adherence and reduces the chance of resistance developing. But for resistant strains, the bacteria have already developed defenses, so the standard regimen doesn't cut it. Instead, treating resistant tuberculosis requires a different strategy, using second-line drugs that are often more complex, longer in duration, and sometimes more toxic. Health authorities like the World Health Organization recommend early testing to identify resistance quickly. Once resistance is confirmed, treatment must be tailored with appropriate second-line drugs, often over 18 to 24 months. While the principle of directly observing therapy remains important, simply applying the original DOTS model without adjustments doesn't work for resistant strains. Studies show that when directly observed therapy is used in resistant tuberculosis treatment, it can improve adherence and treatment success. But it must be combined with the right drugs and a personalized treatment plan. Without this, using the standard DOTS regimen alone against drug-resistant tuberculosis is unlikely to succeed. In summary, the core idea of DOTS, supervised treatment, remains valuable, but the original short-course regimen is not effective against resistant tuberculosis. Managing drug-resistant strains requires early detection, appropriate second-line medications, and close supervision. Always consult healthcare professionals for personalized treatment plans, as each case can vary widely. Effective control of resistant tuberculosis depends on adapting proven principles to the specific resistance patterns and ensuring patients receive the right medications for their situation.